Hi everyone, I am Sherona Bau, nurse practitioner from UCLA. So today we are talking about the serology workup for MASLD and MASH. So from my experience, and I see a lot of MASLD and MASH patients. So very important, for example, if the patient come in and then bring an abdominal ultrasound, which show hepatic steatosis, I think very important, we need to order a lot of blood work to kind of rule out some other chronic liver disease. As a standard of care, everyone, we need to actually order viral hepatitis at least one in a lifetime. So I definitely will try to rule out hepatitis B and C. It's very important, including hepatitis B surface antigen, hepatitis B surface antibody, and hepatitis B core antibody to see if there's any exposure for hepatitis B, and also hepatitis C antibody to see if there's any hepatitis C exposure. So after you rule out viral hepatitis, I think it's very, very important that we order basic hepatic function panel because we want to know if the patient's liver test, if it is abnormal or how high it is, because usually, if the patient, they have MASLD or MASH, the AST and ALT are not significantly elevated, will not be like go beyond 200. So if the liver tests are beyond 200, I think you might need to order a little more tests to kind of rule out some other disease, maybe autoimmune hepatitis or maybe DILI. So I would definitely order ANA anti-nuclear antibody because 10 to 20% of the patient that they have MASLD, they also might have autoimmune hepatitis. So if they have ANA positive and also high AST/ALT, I think that's important that as a provider, we need to rule out any overlap disease such as autoimmune hepatitis. So at that time, you will probably consider liver biopsy because by just checking positive ANA and high liver test cannot determine the patient has autoimmune hepatitis. So liver biopsy will need to be ordered to confirm the diagnosis. And I also do see patients, they come in with mildly elevated alkali phosphatase elevation. And it is also important to order AMA, anti-mitochondrial antibody, to rule out PBC because PBC, you do not really need liver biopsy to give the diagnosis basically. So if the patient, they have AMA positive and alkali phosphatase elevation, you can give the diagnosis of PBC. And the other thing is I also see patients that they have fatty liver, they tend to have high iron. And I would definitely order ferritin and also TIBC and also hemochromatosis gene test to confirm if the patient that they have any hereditary hemochromatosis. So if the patient that they have high iron, it's very important we order MR elastography because MR elastography will give us the idea to see if the patient that they have extra iron storage in the liver. And definitely, I will check PEth test is a phosphatidylethanol test. It is really important that because this blood work PEth test, it is to determine how much alcohol that they drink over the past 30 days. We tend to ask patients how much alcohol that they drink. They always minimize the alcohol consumption. And if you don't order that test and they tell you they don't drink alcohol and you really think the patient has only MASLD, but if you order the PEth test and then if it is positive, you might consider the patient actually has MASLD instead of MASLD or MASH. So it's very important. I will definitely order PEth test. And if the patient really never have any like A1C or a hemoglobin A1C or lipid panel, I definitely will order that. Although I'm not a primary care provider, I still want to find out what is the risk factor for the patient to develop MASLD because you need to, the patient need to have some sort of cardiometabolic risk factor to develop MASLD. So if they never have been checked hemoglobin A1C, they might not know they have type 2 diabetes. That I definitely would check hemoglobin A1C and also lipid panel. And for patients that they are young, and I definitely would check ceruloplasmin because it's a screening for Wilson disease. And Wilson disease is under the big umbrella of steatotic liver disease. So I definitely will not miss that. So after we order all the liver tests and then rule out some other liver diseases, I think it's very, very important that you determine when to refer the patient to hepatology. Because we also need to know, let's say FIB-4 is very, very easy. There's no downtime. That's free if the patient that they have platelet count, AST, ALT, and if you know how old the patient is, then you can actually calculate the FIB-4 and know if they are at risk for any kind of advanced fibrosis. But the problem with FIB-4 is because sometimes 30% of the patient fall in between the indeterminate range. So you might need a next level of NIT. And then it's really, really important. FibroScan, we order every day and look at the kilopascal is the liver stiffness more important than the CAP score, because that you can determine how much liver stiffness, how much liver damage the patient has. If the kilopascal is over 8, you might actually refer the patient to see a hepatologist, because the patient might need more monitoring or hand holding than in a primary care setting, because we work with endocrinologists, we work with a dietitian, we also work with cardiologists to actually monitor the patient's cardiovascular disease and also help them lose weight and then change diet and lifestyle. So I think it's really, really important that we know when to refer the patient to hepatology. And one last thing I want to mention is when the patient come in to see us for a MASH or MASLD, the most important thing that they always will ask the question is, because they don't know how much liver damage that they have. And then they always freak out because they know, are they going to have any kind of liver failure down the road, any risk or any problem? Are they going to live long? I think there's a lot of unknown issue for the patient. I think the key is they do not know how much liver damage that the patient has. They always ask the question, am I going to die, or what is the life expectancy? I think as a provider, I think this is the question that you might need to address and then tell them, or also identify what is the risk factor. Because I know some patients that they do not drink alcohol on daily basis, but they do drink it quite a bit during the weekend and then binge drinking. So I think that is also important. And I will just stop right here. And then I hope this serology workup for MASLD and MASH will help everyone in primary care setting or in GI hepatology setting. And thank you so much. And if you have any question, feel free to actually reach out and in our GAP community network. Thank you so much.